Both the Trump administration and Congress continue to focus their efforts to lower healthcare costs, but there is still debate about how to go about this. Here to discuss more is Dr. Peter Kolchinsky, who just released his new book called The Great American Drug Deal, a new prescription for innovative and affordable medicines. Thank you for joining us.
Thanks for having me, Stephanie.
Your book, The Great American Drug Deal, was just released, and in it you examine the issue of high prices in America's pharmaceutical industry. What are the causes of such high drug prices in America?
Well, I think that's exactly the right question. Why do drugs cost so much for patients? And I think what America hears a lot of is that drug companies charge too much for their medicines. And I certainly talk about that in the book, but that's just not the answer. You basically spend your life paying insurance premiums, you pay taxes, and the bottom line is that when you need your insurance to make medicines affordable to you that your doctor tells you need, they leave you hanging. So if you can't afford a drug that you need, it's because your insurance plan doesn't want you to. I think America's health insurance system is not really selling insurance, and we've got to fix that.
You mentioned pricing control won't fix this issue. Why is that?
So price controls, they can make today's drugs affordable, right? Basically, you can nationalize all the drugs that are out there today, and they will then basically shut down the fuel that allows us to develop new drugs. And there's a better way to go about making drugs affordable for Americans. You offer them proper insurance, and Congress is already discussing this. They're proposing legislation to lower out-of-pocket costs for Americans so that ultimately, when the time comes for them to get what they've been paying for, help with paying for drugs or surgery or anything they need, insurance will actually work for them. So just think of it this way. If America were to pay for fire protection, which in America, fire protection actually costs about as much as drugs do. If we were to pay for our fire department the way we pay for insurance for drugs, then it would kind of work like this. Your house would catch fire. The fire department would roll up to your house. They would charge you a co-payment. And if you couldn't pay, then they would basically let your house burn down. And if you ask them, well, wait a second, why is this? I've been paying my taxes. I need you now. Why are you charging me this co-payment? They would tell you, well, the fire truck is expensive. Well, isn't that the point? If drugs, if healthcare, if it were inexpensive, you wouldn't need insurance. So I think that the same expectations you have that when you've paid your whole life for insurance, that it's going to make what you need affordable to you, I think we need to live up to that.
You suggest that insulin has become the proxy issue in Congress's battle to lower healthcare costs. What needs to be addressed by lawmakers in order for Americans to see changes in their healthcare costs?
So we need to lower out-of-pocket costs. We need to lower deductibles. We need to lower co-payments. We need to make sure that ultimately when your doctor prescribes a medication for you, you'll be able to afford it. It's that simple. And when we've done that, when we've made sure that ultimately the costs of developing new drugs, of paying for all the innovation we've got out there are spread out widely across society, then I think what we're going to discover is that America gets really great value from drugs. Unlike any other aspect of healthcare, drugs are the only thing that actually go generic. They become really inexpensive over time. Our parents basically paid off the mortgage for a whole bunch of branded drugs that are now generic, right? And we're doing that for our kids. Whereas surgery, hospitals, they never go generic. It's like paying rent forever. And the insulins that are out there now, I got to say that your insurance company may be making more money off of you because you're sick. And it's kind of twisted, but some insurance plans will negotiate very steep discounts for products, including insurance. And when you actually need that drug, when your doctor prescribes it to you, your insurance company makes you pay the full list price, even though they negotiate a discounted one. And they take all that money that you pay them out of your deductible for the full price. They give only the discounted amount to the drug company, and they pocket the difference. Can you imagine that? They ultimately make more money off you because you get sick. Congress has to fix that.
Why is it there's been a lack of advocacy from Big Pharma to make drugs more affordable?
Well, I think it's probably been lost in the noise around drug pricing. There's certainly been a lot of efforts to try to make drugs more affordable for patients. All these scientists that are out there working, they don't invent these drugs so that patients don't get them. They want them to get them. I don't think that pharma's been doing a very effective job of making the case for the value that drugs offer America. Like generally, they don't talk about, hey, someday my drug will go generic and it'll still be useful for the rest of all time. I think as soon as you hear, talk about how patients can't afford drugs, you immediately hear the industry say, oh, well, innovation is expensive. And that's a bit tone deaf. That's not, in fact, what is being asked. The patient is saying, wait, how come I can't afford drugs? And the answer should have been, because your insurance doesn't want you to. And we should have spent, a lot more time while we were developing these breakthrough drugs, also lobbying like crazy to get Congress to reform our insurance system so patients would be able to afford all these drugs when they were finally invented and approved by the FDA. So I think we're stepping up now, and this book is a part of it.
And speaking of your book, where can our viewers go to find the Great American Drug Deal?
Well, like with every book, Amazon.
Amazon. Okay. All right. Dr. Peter Kolchinsky, thank you so much again.
Thank you very much.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.